Hi, good morning. This is Dr. Reiser, and I will be telling you some things about the diagnostic kit that you should have already received. If you haven't received it yet, please go to Blackboard. There's a way to order the kit to be shipped to you at your expense, but hopefully you've already have your kit, which looks a lot like this, very similar to this, just has a different number. It will come with several other pieces, a tuning fork, a Denver developmental paperwork, and so forth. But today I just want to talk to you a little bit about the equipment inside the diagnostic kit and just a brief overview of how to use each piece. Okay, so let's get started. First of all, I want to show you the tuning fork. Now, you may or may not have used this before. It is mostly an advanced assessment tool. So the tuning fork is to evaluate hearing and hearing loss. It's used by striking it on your hand. I use the fat pad on my palm here. So I've seen some people strike it on the back of their hand. That's more painful. I would strike it here on the edge of the lateral aspect of your palm. Give it one good strike. You'll feel the vibration throughout it, and that's when you can place it on the patient's head. If you place it on your own head, you can feel the vibrations through the bone, conduction through the bone. You can also place it on the mastoid process depending on which test you're performing on your patient. Now, the other thing about the tuning fork is if you hold the tuning fork up here on the body where the tongs are separated, it will disperse some of the vibration into your hand, so you're really not getting good conduction. So always hold it just by the handle, give it a good strike, and then place it holding it just by the handle. Okay, so that's the tuning fork. Now, also in your kit, you will have two things, an ophthalmoscope and an otoscope. The handle is common to both of them. This is your light source. So we'll first talk a little bit about the ophthalmoscope. It's easily put together. It has a little indentation here, which aligns with this little dot here on the scope itself. Just fiddle with it a minute, you'll get it. You need to depress it and twist it in order for it to stay on. Okay, so depress and twist. Twist to come off, depress and twist to place the head. Okay? Now, in order to activate the light source, there's a little green button here on the side. You depress it and swivel it. Okay? It only goes one way, and then you'll see that there is a light source. I'm going to turn the light off for right now. Now, on the head of the ophthalmoscope, you'll see the words Welch Allyn on the front, and that is the front where the light comes out. Okay, you have a couple of options for light source there. You have a white light and a green light, or I believe the other one is off. You also have a little dial on the front, which is like a little thumb wheel, which allows you to change those settings. Okay, on the side is a thumb wheel. It works from either side. It does the very same thing. So whichever hand you have your scope in, your finger should be up on this thumb wheel at all times so that you can change the focus. So when you place your head, this is the back side of the ophthalmoscope head. It has a little forehead rest here. So that goes kind of against your eyebrow. You look through the lens and you're able to focus with your finger here. Okay, so you will have the light turned on. You'll see that there's a light. You will decide which of your apertures that you want to use, and you can click through them. There's also a slit, a large aperture with a grid, a large aperture with no grid, a medium aperture, and a small aperture. I would probably use either the large or the medium clear aperture for our purposes in this class. The other thing that I would encourage you to do is be aware of the light strength, the light source strength of the light, because it can be very, very bright. So if you turn it all the way on, it's extremely bright. So be aware of that when you're shining it in your patient's eyes. They won't be able to tolerate it very long. So please take care of your family and your friends and your dog or whoever's eye you're examining, and don't shine that high intensity light in their eye for very long. Now what you can do is just once you depress the little green button and swivel it around, just don't go all the way. You can go part ways, and you'll see that that changes the intensity of the light source. So you can have a more prolonged exam if you start out with not so intense of a light. Okay? All right, that's the ophthalmoscope head. Now I'm going to take that off and show you the otoscope. It fits the same way. Just swivel it around until the little notch clicks in, depress it, and swivel it to lock it into place. Okay, same with the ophthalmoscope. You'll notice that it also has a lens, which you look through. Obviously, everybody's had an ear exam at one point. And you have a, let's see where here's a little cover for your otoscope. So you just twist, depress, and twist, and lock that in place. These are one-use covers. For the otoscope, of course, you will hold it like this, not like this. And there's a reason for that. You must, when you approach your patient, anchor your scope. If anything you're doing invasively to a patient, you need to have an anchor finger. So with this, you want to stick your little finger out, place it against their head, look at what you're doing, place the otoscope, and then look. Okay, so you have this finger on their head somewhere. Okay, that anchors it. And we're going to talk about that kind of technique and so forth when you're here for intensives, but for the purposes of this video, I'm just showing you kind of how the equipment works. Okay, so hold it like this, anchor, place. This comes off with just a twist, disposable. On the side of the otoscope is also a little source for your light that you can change the focus, and you can adjust that according to what you need. Okay, turn the light back off, remove the head. Here's an important thing that students usually aren't aware of until they get to mid-semester and they come to intensives with a handle that is not charged. There are inside here rechargeable batteries, but you don't have to do anything to the battery because it has this cool little thing where you unscrew it and just plug it into the wall. Okay, so just plug that into the wall. Now, if you unscrew it at the wrong level, you see this has a little rubber separator here. If you should unscrew it below the little rubber separator, you will see the battery. So if you do that, don't worry, yours does have a plug. So just screw that piece back on and hold the little rubber separator and unscrew the top and plug it in. Okay? So when you come to intensives for midterm and for final, you'll want to be sure and have your ophthalmoscope and otoscope handle charged up and ready to go. Okay? That is about it. Some of the other things I'll be talking to you about on other videos, but I can't wait to see each of you at our on-campus intensive. And just a note about that, when you do come to our on-campus midterm intensive week, you will be learning. That's a learning week, and we realize that. However, you will need to have practiced your head-to-toe assessment skills. And by this I mean every day, every week, several times a week, whatever works for you, you practice all the items on that rubric, and that is the 4-page, I believe it is, rubric with all the items listed and a place to have a grade at the bottom. That's the form that you need to be going by to practice, okay? And if you have questions about this, please contact one of your faculty and let us know. We'll be happy to set you straight on where to look for it, how to use it, and so forth. Discussion board's usually the best place to go and ask questions like that, okay? But otherwise, contact us. We're here for you. Happy assessment, and we'll see you soon. Bye-bye.